Please have your completed MAR ready. We will continue to build on this foundation. In this lesson, I will be teaching you how to update the MAR, document medications that are not given, the information that is documented on the back of the MAR, and how to document the administration or supervision of the self-administration of a PRN medication. The MAR is a dynamic document, and there will be times when you need to make changes. Medications may be added or discontinued. The doctor's instructions may change. The prescription may be time limited. The reasons the MAR needs to be updated are numerous. In this lesson, we will look at the steps for making changes on the MAR, how to document a medication that is not given, and document the first 3 doses of a new medication. As we work through, please do not hesitate me at pat@mededamerica.org if you have questions or need a little more help understanding the process. We will be using Jesse James's MAR that we completed in the last lesson. Go to your worksheet for the information for this exercise or copy it from this slide for your use as we work through the lesson. I will use the step system again. On July 8th at 1 a.m., Jesse woke up screaming in severe pain. You called your supervisor and she came in and took Jesse to the emergency room. At 9 a.m. on July 8th, when Jesse returned to the group home, the doctor's diagnosis was a severe urinary tract infection. He wrote the order for Bactrim DS, see below. The prescription was sent to the pharmacy and will be available for the nighttime dose. You called the primary health care provider and he agreed with the doctor's orders and sent the reconciliation information by fax. Bactrim DS 800 mg/60 mg, PO every 12 hours for 14 days. Encourage PO fluids. Prescription written by Dr. Smith on July 8th, 2019. We will add this time-limited prescription to the MAR. Let's review our steps for adding a medication to the MAR. Step 1 and 2, double-check the header to be sure everything is correct. Name, month, year, and allergies. Please add any new allergies that are discovered. Then we move on to steps 3 and 4, adding the medication information to the MAR. 1. Write the name of the medication and the strength. Bactrim DS, 800 mg/60 mg. 2. Write how many and what route. Take 1 tab by mouth. 3. Write how often and in this situation for how long. Every 12 hours for 14 days. 4. Write special instructions if applicable. Encourage fluids by mouth. We finish entering the information by completing steps 5 and 6. Writing the time the medication is to be given. The order fits into the BID standard times perfectly since they are 12 hours apart. The last thing that must be entered is the prescriber's name, which is Dr. Smith, and the date of the prescription, which is 7/8/19. After entering all of the information for the Bactrim, go to the next slide and confirm your entry is correct. Make any corrections if needed. Steps 1 through 6 have been completed. Please look over the entry carefully and note where everything from the prescription is recorded. This is the format you should always use when adding a medication to the MAR. There's one more thing that needs to be done. We have to indicate the starting and the ending date for the antibiotic since it is a time-limited order. I will show you how to do that on the next slide. Since Jessie wasn't prescribed the Bactrim until the 8th of July, and her first dose will not be available until the nighttime dose, we will line out all of the squares from July 1st through July 8th for 7 a.m. Then we line out July 1st through the 7th for 7 p.m., since she will be getting her first dose at 7 p.m. on the 8th. Next, we need to count the doses for the 14 days and line out the squares for the rest of the month, since she will not have any doses due. Notice that the line out starts on the 22nd for 7 p.m., but starts on the 23rd for the 7 a.m. days. After all the doses are given, then you will need to discontinue the entry on the MAR. I will show you how to do that on the next slide. Please line out the appropriate squares on your worksheet, then go to the next slide. When Jessie completes her antibiotics, we need to discontinue it from the MAR. There are 2 steps. First, write the reason the medication was discontinued from the MAR, the date, then your initials. Since this is time limited, you would write completed, the date, and initial. Second, take a yellow highlighter and yellow out the entire row. Use this process to update the MAR whenever you have a change order or a discontinue order. Medication completed, write completed, the date the medication was completed, and initial. Discontinued, write discontinued, the date, and the medication was discontinued, and your initials. Change order, write order changed, the date, the medication was discontinued, and initial. See below. After writing while you are removing the entry from the MAR, highlight the entire row with a yellow highlighter. The discontinued medication order should not appear on the next month's MAR. If it is on the new MAR, notify the pharmacy or the person that prepares the MARs. Then write discontinued and the date the medication was discontinued and highlight the entire row. Remember to always line out doses not given if a medication is added to the MAR and is not started on the first of the month. Before we move on to the next slide, I would like you to take a moment to look at the 7 a.m. doses that were due on the 8th. Notice the initials are circled. We will be talking about this and I will show you the required documentation associated with this situation. When a dose of medication is missed, regardless of the situation, you must document the missed dose and complete a medication error report. The documentation starts by you initialing the appropriate box and circling your initials. If you look closely at the example, you will see that PC circled her initials for both medications at 7 a.m. MedPass. Remember, Jessie was still at the emergency room at that time. A medication error report should be completed and the doctor's office must be called. Explain the situation and get written instructions concerning whether or not she should get the medication when she returns from the emergency room. The documentation of the missed dose continues on the back of the MAR. I'll show you how to do that next. Before we continue, I would like you to take a minute to think of reasons a medication dose is not given. There are so many reasons that your client may miss a dose. They are in the ER. The family forgets. You're stuck in traffic. They refuse to take it. The clinic hasn't responded to the pharmacy's request for a refill order. The list could go on and on. Regardless of the reason, you will go through the same steps. Again, write the steps down, do whatever you need to remember them, and make it your routine when documenting and dealing with a missed medication. After initialing the box for the dose and circling it, turn to the back of the MAR and follow the steps below. 1. Write the date and time the dose was due. 2. Write the name and strength of the medication. 3. Write the reason the medicine wasn't given. In the ER, refused, etc. And any pertinent information. For instance, Jessie said she didn't want it. I offered her meds several times before 8 p.m. 4. The last step is to initial the end of the column. Always be sure that you have signed and written your initials at the bottom of the page. I would like to take a moment to share an experience. When I was doing validations for a group home, I noticed the MAP had drawn squares around the days the medication was to be given, then drew a line through the days it should not be given, similar to the example on this slide. The square around the initials could be confusing and is unnecessary. My question is, what would you do if the doctor tells you to hold a dose? It would be difficult to see a circle around the square that is around the initials. If you have an order that is not given daily, either line out the squares or put an X in the boxes for the days the medication is to be skipped. A person's medical situation changes, so will his medications and treatments. The next task we will be looking at combines the two that we have already learned. Again, I encourage you to write down the steps and always approach recording changes to the MAR in a systematic way. For this exercise, we will make a change to a current order. Please use the following information. Jessie is having frequent outbursts, appears to be anxious most of the time, and is having difficulty sleeping. You made a doctor's appointment for July 24th at 10 a.m. Dr. Jones made some changes to her medication. He increased her routine dosage of Ativan and gave you a PRN medication order for insomnia. The pharmacy was able to fill the new prescriptions and get the medication to you for the evening med pass. The doctor's orders are below. Ativan 1 milligram by mouth twice daily. Ambien 5 milligrams by mouth as needed for continued wakefulness that persists longer than 1 hour after going to bed for the night. Do not re-administer during the same night. Call the doctor for further instructions if she is unable to sleep for at least 5 hours. The first step would be to discontinue the current order for Ativan on the MAR. Remember, it is an automatic discontinue when you get a new order that changes the dose. First, you would write discontinue and the date. Second, black out all of the squares for the rest of the month. Then the last step is to highlight the entire row with yellow. Please enter the changes on your worksheet. I will show you what it should look like on the next slide. Be sure your MAR looks the same. If not, make the necessary changes. A quick review of the steps. 1. Write discontinue, the date the medication was discontinued, and your initials. 2. Line out the squares for the doses that were not given. 3. Highlight the entire row with yellow. Note, the block for the 7 p.m. on the 22nd is not lined out. Anthea will be giving the new strength at 7 p.m. since the pharmacy was able to fill the new order and get the medication to the facility for the evening med pass. Now we need to add the new order for the Ativan. A quick review of the steps. 1. Write the name of the medication and the strength. 2. Write how many and what route. 3. Write how often. 4. Write special instructions if applicable. 5. Write the prescribing practitioner's name and prescription date. 6. Write the time or times the medication is to be given. Be sure to update your worksheet before moving on to the next slide. After you've entered the information, the last step will be to line out all of the squares before the medication was started. Notice the morning dose on the 24th is lined out, but the evening dose is not since it will be the first dose that is given. On the next slide, you will see the completed MAR with the change order. Make sure your worksheet looks the same. If not, make corrections. We are not finished. We still have to record the PRN medication that was ordered. I will teach you how to do that in the next exercise. Take a few minutes to look over the MAR. Look at all of the examples of tasks that you may have to do. Missed dose, discontinuing medication, discontinuing a time-limited medication, and adding a new medication that started partway into the month. If you don't know how to do each and every one of these tasks without looking at your notes, you will need to go back, study, and practice that procedure until you can do it in your sleep. Please notice I have signed off the first 3 doses of the new Ativan order on the MAR. Remember, you must directly observe the client for at least 20 minutes for the first 3 doses of a new medication. An observation note and any reactions must be documented on the back of the MAR. If there was no reaction, write no apparent reaction. Fill this information in on the back of your MAR, then click on the next slide to see how you did. Anthea gave the first and the third dose, and Cindy gave the second. The date and time, the medication name and strength, the fact you observed the client, the reaction to the medication, if applicable, must be documented. Always be sure you initial at the end of the line and confirm that you have signed and initialed the bottom of the page. Be sure you update your worksheet and make any corrections before continuing to the next slide. I highly suggest that you use a separate page for your PRN medications. Since the instructions are entirely different for PRN meds, you should easily be able to tell the difference. However, your efficiency will be affected if you have PRN med orders scattered through your scheduled or routine medications. Please take the blank MAR out of your worksheet and complete the entry for Jesse's Ambien, which is a PRN medication. Use the same steps you learned for setting up a MAR page and adding a new medication. I have completed the entry for the PRN medication for you. Double check your worksheet and correct any errors. On the next slide, we will go through the steps to document the administration or supervision of a dose of a PRN medication. The steps to document the administration or supervision of a PRN medication are below. 1. Read the order and confirm the dose may be given. 2. Check in the time column to see if there is a time that is the same as the dose you will be giving. If not, write the time in the time column. 3. Initial the appropriate box corresponding with the date and time. 4. Be sure you have signed and initialed the bottom of the page. 5. Document on the 5. Document. Fill out your MAR using the information below. Jessie told you, "I just can't go to sleep," and asked for her sleeping pill. In the exercise, we will be documenting 3 doses, then documenting them on the back of the MAR. July 24th, she asked for her sleeping pill at 9 p.m. July 25th, she asked for her sleeping pill at 9:15 p.m. July 26th, she asked for her sleeping pill at 11 p.m. Document the doses and times on the front of the MAR. Then go to the next slide and check your work. Update the worksheet before going to the next slide. Look how the doses were documented on the front of the MAR. Anthea gave Jessie the first dose at 9 p.m. on the 24th and the second dose at 9:15 on the 25th. Notice how she signed the medication off on the front of the MAR. John gave the third dose at 11 p.m. on the 26th. Make any corrections to your worksheet, then go to the next slide. This is the first step in documenting the administration of PRN medications. Let's go to the back of the MAR and complete the documentation. You will be documenting the reason and the response for the PRN medication and the observation for the first 3 doses of a new medication, since the Ambien is a new order. Remember, Anthea gave the first and second doses. John gave the third dose. For the first 3 doses, you will document both the information needed for the PRN administration and the 20-minute observation. Remember, for PRN, document date, time, medication name and strength, why you gave the medication, and around 30 minutes later, the client's response to the medication. For the first 3 doses of a new medication, you will document that you observed the person for 20 minutes and how they reacted to the medication. If there is no reaction noticed, then you would document that. Just write what you see. Document all 3 days of the medication that was given to Jessie. Use the information that was supplied to you for the documentation on the front of the MAR. When you have finished, go to the next slide and see how you did. Make any corrections. Anthea gave the first and second doses. John gave the third dose. For the first 3 doses, you will document both the information needed for a PRN administration and the 20-minute observation. Remember, for PRN, document date, time, medication and strength, why you gave the medication, and around 30 minutes later, the client's response to the medication. Okay, this finishes up the documentation for the MAR. Be sure you have completed your worksheet MAR and corrections if any have been made. You may use this to study for your MAR exam to help you remember all of the steps and parts for completing various tasks needed for documentation on the MAR. Again, if you have any questions concerning MAR documentation, please email me at pat@mededamerica.org and I will be more than happy to help. Next, we will be looking at what information and documents are required to be in your MAR book.